Story time. About 6 years ago, I was pregnant with my middle child. Largely pregnant, 30-something weeks. Thanks to the rotundness of my abdomen, I wasn't really able to do a lot of the heavy lifting, but I could still do certain tasks like starting IVs, doing wound care, those sorts of things. I ended up picking up a patient load when I went down to the first floor. There was a nurse who she wasn't feeling well, so I took over. I got a report on the patient. Patient had a condition called bullous pemphigoid. Cool, it sounds like some sort of skin thing. I guess I'll just look that up later. Got through all of the report. I think there were like 3 or 4 patients that I was accepting at that point, and I was open for an admit or something like that. So I was fairly busy, but not too busy to look up the condition. I'm a wound treatment associate. Wounds have never bothered me. Vomit, poop, and you name it, it's fine. Respiratory secretions, no. And thankfully, this was not like a situation in former videos that had anything to do with any type of bugs, which I also cannot do. Specifically the ones under your skin. Anyways, I look up pictures and an allergic reaction type of thing. The patient's body has an immune response that's inappropriate and overreacts and makes the skin blister up into boils. Normally the only treatment for it is like steroids, that kind of thing. So I go in, I introduce myself to the new patients that I'll be caring for, and I left this one for last, really do a great skin assessment, and I knew it would be in depth because it was apparently a pretty bad outbreak. Finally make it down to the room, and I see that the patient is on isolation, which is usually not a big deal, but it is kind of a red flag after you've been a nurse for a while and there's nothing that's actually isolating on the patient. Sometimes what we do is we use that isolation gear to protect ourselves from things that might otherwise not be acceptable to have get on us. So I put on the gown because I know better now. Put on the gown and the booties. And as I'm putting on the booties, I think to myself, why are there booties? For those of you who are non-medical, booties are the little foot coverings. Usually we don't use those unless there's bugs involved. I put on all the coverings everywhere and gloves included, and I go into the room. And the first thing that I hear is crackling. I thought somebody had dropped a bag, like the wrapper for the isolation bags, on the floor. So I looked down and I noticed that there's all sorts of plastic on the ground. I keep walking to see if the patient's okay, because usually if there's a bunch of trash around or, things that I'm not expecting in a room, the patient's probably not cool with it either. I walk in and there continues to be crackling. I walk toward the patient, more crackling, more crackling. This is one of those rooms that has kind of like a long entry because the bathroom is right there, and then you kind of round the corner and the patient's bed is right there. So I couldn't immediately see the patient until I had already walked into the room. I finally get to the patient after walking over all the crackling. I see a larger man hunched over the edge of the bed, sitting there picking it. The man picks from his right arm in front of him. His back is facing me. He's looking out the window, which is opposite me. Reaches over to his right arm and pulls off a sheet. I thought he had like an IV cover or something. When patients go get in the shower, we put like a little plastic sheet over them. So if they don't get the IVs wet, they can shower, then we peel off the plastic sheet. Maybe I didn't have my contacts in or whatever. My vision's not that bad. So maybe it just didn't make sense because I didn't want it to, but he was pulling it from up higher than I remember them saying he had a peripheral IV access. So I walk over. He pulls off the sheet of plastic from his IV. He goes, "Oh, I didn't see you there. Should I throw this away?" And I grab it with my, thank God, gloved hands. I realize it is skin. A sheet of skin. About the size of a half of a sheet of standard copier paper. Crispy human flesh that has left the body. I said, "I need to go get your hydrocortisone cream. I will be right back." And I don't remember anything after that because I was in the emergency department from having passed out and hit my head on the floor. Turns out, as I went to walk away, I guess the crackling on the floor, I realized was human flesh, dried skin flakies. Not just any skin flakes, though. Not the dust that we're used to, like aerosolizing and inhaling. No, giant sheets, at least the size, every single one of them, decks of cards. at least that large. Giant sheets of flesh all over the floor that had been torn off. Because what happens when bullous pemphigoid heals is it peels off the top of blisters, leaving sheets of skin for people to just chew on. That's the day that I learned that it was probably time for me to go on maternity leave and just call it good. Man was very sweet. I did return to him and explain I was so profoundly sorry. He was okay. He was healing very well. It was actually a good sign that he had all of the little flesh, as the steroids that we were giving him were working. And we identified his allergen at home that caused the really bad outbreak, and everything got better. My sweet baby that was born just a few short weeks later is perfectly fine. All ended up working out, but when you see a condition like that, always wear the gown.